Asthma is a long-term condition that affects the airways, the tubes that carry air in and out of your lungs. For some people, asthma is a minor nuisance. For others, it can cause serious disruption and, at times, be life-threatening. I'm Dr. O'Donovan, and in this video, I'll guide you through what asthma is and why it happens, the symptoms to look out for, what causes and triggers asthma, how it's diagnosed and treated, how to make the most of your treatment with a personalised asthma action plan, and finally, but perhaps most importantly, what to do in an emergency situation like an asthma attack. So firstly, what is asthma? Well, asthma is a condition that causes your airways, especially the smaller tubes deep in your lungs, to become inflamed, swollen and narrowed. This makes it harder to breathe, especially during a flare-up. Now, asthma affects around 8 million people here in the UK. That's about 1 in 12 individuals, so it is a really common condition, and it can develop at any age. Now, some people grow out of it, whilst others are first diagnosed as adults. Now, in terms of symptoms, asthma symptoms usually come and go. They can range from mild to severe, and they may last an hour or two or persist for days or weeks unless treated. So now let's take a look at the symptoms in more detail in the next section of this video. So what are the symptoms of asthma? Well, typical symptoms of asthma include wheezing, which is a whistling sound when you breathe, coughing, which is usually dry, and it's typically worse at night or early in the morning. Some people describe chest tightness, which is a feeling of pressure or discomfort around the chest area. But if this doesn't go away, you do need to seek emergency medical treatment, as well as breathlessness, feeling like you can't get enough air. Now, these symptoms might come and go, they might vary in severity, or only appear when you're exposed to a specific trigger, such as exercise, cold air, or allergens like pollen or dust mites. And we'll discuss these more later on in the video. And remember, not everyone with asthma wheezes. Sometimes fatigue, a persistent cough, or frequent chest infections are the only clues. Now, asthma also typically exhibits diurnal variation, meaning symptoms and lung function fluctuate throughout the day, often being worse at night and early in the morning, whilst then improving during the day. So what causes asthma? Well, asthma is caused by chronic inflammation in your airways, making them more sensitive to triggers. When exposed to a trigger, the muscles around your airways tighten, the lining swells, and extra mucus is produced, making it harder to breathe. Now, many people with asthma also have what we call atopic conditions like eczema, hay fever, or food allergies. This is known as the atopic triad, and it reflects a shared tendency towards allergic inflammation. Asthma may be also more likely to develop in people with this genetic or immune background. Now, common asthma triggers include viral infections such as colds or chest infections, exercise, especially in cold or dry air. Some people find that their asthma actually flares up in the winter because of this. Pollens, molds and dust mites, air pollution, cigarette smoke, chemical fumes, stress or strong emotions, and even certain medications like aspirin, ibuprofen or beta blockers. And with some people, weather changes, like I mentioned, especially sudden cold air. Now, everyone's triggers are different, but keeping a diary may help you to identify yours, and this can be a really helpful thing to bring with you to your initial appointment if you suspect you do have asthma. So how is asthma diagnosed? Well, diagnosis often starts with a conversation with your doctor where you go through your symptoms, your family history, and what seems to make things worse. And that's why keeping the diary can be really helpful, and you can bring this with you to your appointment. Now, some tests that might help confirm asthma include spirometry, which measures how fast and how much air you can breathe out, something called peak flow monitoring, which are regular home readings to track airflow over time, again where you breathe out into a small little tube, an FeNO test, which measures inflammation in your breath, and blood eosinophils, a type of white blood cell raised in allergic asthma. Now, in children under 5, a formal diagnosis can be difficult. In those cases, doctors may treat symptoms first and then monitor the response before confirming asthma. So talking of treatment, how is asthma treated? Well, asthma is most often treated with inhalers. These are devices that deliver medicine directly into the lungs, and there are 3 main types of inhalers. Firstly, reliever inhalers. These are usually blue in colour and they contain salbutamol, also known by the brand name Ventolin or Terbutaline. Now, these are used when symptoms appear. They act quickly to relax the airway muscles, making breathing easier. But they should not be the only treatment if you have regular symptoms. The second type are preventer inhalers, usually brown in colour, containing an inhaled steroid like beclometasone. Now these should be taken every day, even when you feel well. They reduce inflammation in your airways, helping to prevent symptoms altogether. And thirdly are long-acting bronchodilators like salmeterol or formoterol. Now these are often combined with a steroid in a single inhaler. For example, you might know these by the brand names Seretide, Foster or Symbicort, and these are used when symptoms aren't controlled by steroids alone. Now in addition to inhalers, there are other treatment options. Whilst these are more specialist, they're things like leukotriene receptor antagonists like montelukast, or short courses of steroid tablets for sudden flare-ups, or even what we call biologic therapies for severe asthma. But these are given by specialist teams, so we won't go into detail about these in this video, but it's just so that you're aware of them. Now importantly, every person with asthma needs to have a written asthma action plan. This is a personalised guide developed with your doctor or asthma nurse specialist. Now this written action plan needs to include your daily treatment, how to adjust treatment when your symptoms or if they worsen, what to do during an asthma attack, when and how to seek urgent medical care, and what your personal best peak flow reading is. Now, research shows that having a clear plan improves symptom control as well as reduces hospital visits. Now, if you don't already have one of these, don't worry. You can download one for free from Asthma and Lung UK, and I've included a link in the description box of the video for this, so you can go directly afterwards and download it and complete it. So if you have asthma, what do you need to know? Well, most people with asthma can live a full, active life with the right care, but there are some things that can help. Firstly, learn how to use your inhaler correctly. This might sound very obvious, but it is amazing how many people don't actually know to use an inhaler properly. For this, you can ask your pharmacist or nurse to check your technique, or for a great video on how to properly use your inhaler, my friend and colleague Dr. Sophie Newton has produced a really excellent video on this, which again I've linked in the description box of the video. Next, I would say attend annual asthma reviews. Get the flu jab every autumn, know your triggers and try to avoid or reduce them, try to follow or at least have an asthma action plan, and importantly, don't ignore worsening symptoms. Early action can prevent serious attacks. Now finally, let's end this video by discussing something that can be life-threatening for those living with asthma, which is an asthma attack, and this will include how to recognise it and treat it. So an asthma attack happens when symptoms become much worse, often quickly. It can be really frightening and dangerous, so it is essential to know what to look for. Now, signs of an asthma attack can include a variety of things, but typically you'll notice the person is wheezing, coughing, or more breathless than usual. The reliever inhaler, so the usual blue inhaler, isn't helping. They're too breathless to speak in full sentences. They might be bent over, really gasping for air. The lips or fingertips could look pale or blue, or the peak flow reading is much lower than usual. So what do you need to do if you or someone you know is having an asthma attack? Well, firstly, sit upright and don't lie down and try to stay calm. Next, take the reliever inhaler, which is usually the blue one. Take one puff every 30 to 60 seconds, up to a total of 10 puffs. Now, if you don't feel better after the 10 puffs, or you're getting worse, make sure you call 999 or your country's emergency number immediately. Now, while waiting for help, keep taking one puff every minute until the ambulance arrives, up to another 10 puffs if needed, and try to stay as calm as possible. Now, don't wait to see if it gets worse, and if in doubt, seek urgent help. Severe asthma attacks can be fatal. Now, if you want to learn more about asthma from trusted resources, I've included links to these in the description box of this video. And if you want to share your experiences of living with asthma to help others who are watching this video, please do so in the comments section. And why not check out this video next?